welcome to Beginners E-Corner channel. So today we are all set up with our new freshers 2024 batch of SNS College of Nursing. So here we are going to demonstrate on how we can do a case study based video. So our case is that a patient being Mrs. X being admitted for the past 3 days. She was suffering with fever and vomiting as well as diarrhea. So here being the first vital parameter, we are planned to do the vital assessment. So here we are set right with our TPR assessment. So in this we are not going in detail with the blood pressure, but blood pressure we will see separately. So we are going to assess temperature, pulse, respiration. So before going into the topic, let me introduce the speakers who are going to do. This is the 2024 batch which is being led with Akshaya. Yes, Ms. Pyrexia, can you tell me the procedure?
First identify the patient.
Yeah. So we can divide the procedure into three major components. One is pre-procedure, during procedure and after procedure. So pre-procedure is before we start the procedure to the patient. As Akshaya told, we have to find out who is the right patient. So whether it is the right patient or not. How you can identify? By using the patient. If the patient is having ID tag, you can see it by the patient's wrist where ID tag is being placed. Along with that, you can cross check with the document whether it is Mr. Shanti or not, and then we can start the procedure. After that, can you guess out what can be the second point?
Keep the doctor's order.
Yeah, we have to keep the doctor's order and check the doctor's order. What are the limitations for the patient? For example, some patients may undergo surgery, may have been undergone surgery or recent any injuries. So in order to know the limitation of the patient, we have to check the doctor's order. Any other point you have?
Articles.
Yeah, very well said. So we have to keep the articles by the bedside so that it is not going to waste the time of the nurse's time. Then,
Explain the procedure.
yeah, that's a well said point. We have to always explain the procedure before you start. Even it can be a minute or a major procedure. Even in a minor or major, you are going to tell what is the purpose we are standing here. So how we can explain this procedure? So you have to say, hello Ms. Shanti, good morning, how do you feel? So today I am going to assess your temperature, pulse and respiration. Will you be able to cooperate throughout the procedure? Are you feeling comfortable? Can I start the procedure? This is how you gain the confidence of the patient. Then, yeah, well said, Mr. Lakshmi. So we have to perform the hand hygiene. Either if there is hand rub in your hospital, you can use the hand rub or you can use the soap and water solution, and you can follow the 7 steps of hand washing. After hand washing is done, then what can be the major one? For providing privacy. So here privacy means you are going to, might be if it is axillary temperature or rectal temperature, you may need to have privacy by providing the screens, because it is something you are going to expose the private part. Other than that, if it is a oral temperature, no need for any privacy.
During procedure?
Yeah. So during procedure, what we are going to do? So during procedure, before you keep the articles by the side, as a nurse we have to prepare the lotion. So if you are going to use Dettol, the dilution for disinfecting is 1:40. And then we have to have a separate bottle which is tinged with cotton. So this is for rinsing the thermometer. Because if you are going to directly place the thermometer into the patient's oral cavity, that will create an ill taste to the patient, which may induce vomiting. So what we have to do is that after you take it from the disinfectant solution, you have to use the cotton swabs and you have to cleanse the thermometer. So before cleansing, how you do is that we have to wash it in the normal water, which is the other water which is without the disinfectant, and then we are going to clean the thermometer. So always before you put it onto the patient's hand, it is from bulb to stem. So this is the bulb portion and this is the stem portion of the thermometer. So how you clean? You put it over here, and in a circular technique from bulb to stem, you are going to cleanse it. After you have cleansed it, then you have to discard it onto the kidney tube. And see that we have to shake the thermometer. Why are we shaking? Any idea? Because there is a mercury In between and there is a constricted ring. So it should fall below the normal level. Then only we will identify whether the patient is having temperature or not. If already the temperature has been noted as 101 and if you are not shaking the thermometer, if it is a mercury one, if you place it onto the patient may have higher levels of temperature. That's why you shake at least 2 to 3 seconds, not dropping the thermometer. Check it against the light source and see that the mercury has come over here. So when you keep it against the light source and just dangle the thermometer, you can have the changes. Then after that, after you confirm, then if it is oral, ask the patient to open the mouth, put it under the patient's tongue and ask the patient to hold it. Meanwhile, what you are going to do is that, what we can do, we can have the hands little raised and kept onto the chest. Why are we keeping this in the sense? The first minute we are going to check on with the temperature. Simultaneously you will be assessing the radial pulse or pulse. So in pulse you are going to assess rate, rhythm, volume and tension. After you assess the pulse for full 1 minute, simultaneously you are going to see for the next 1 minute the chest wall movement, which is respiration. This is how you do the temperature, pulse, respiration simultaneously. So once this procedure is over, so the patient should not be aware that he or she is being counted for respiration because they may manipulate the respiration. That's why we have to wait and then allow for the chest wall movement. Once the pulse is over, don't remove. Even if you are counting only respiration, keep your hand along with the patient's radial artery. After you count the chest wall movement, then all the procedure is over. Slowly, meanwhile the oral temperature is also completed. Then again you can rinse it. First you have to do what? You have to do it from stem to bulb. Before keeping onto the patient's mouth, from bulb to stem. After you take it from the patient's mouth, from stem to bulb, do it in rotatory fashion. Put it under the light source, check the temperature and you can disinfect. Put it into the disinfecting solution. So if it is a digital thermometer, you are going to use the digital thermometer and then see that it is in working condition. Just have a click onto the switch on and off button. Once you hear the beep sound, then you can put it onto the patient's axilla because if this is going to come into contact with saliva, the thermometer durability will be lost. So that is why in cleaning digital thermometer, mostly we prefer for the axillary part. The only thing you have to keep in mind when you are using axillary temperature, you have to cleanse the axilla by using a rag paste. If the patient is conscious, patient will be able to do so. If not, we have to cleanse the axilla. It's because to dry the area, then you can put it onto the axillary region. And if it is oral, it is 2 to 3 minutes. Contact time, you are going to just axilla 3 to 5 minutes and rectum it is 1 minute. So in rectal thermometer, the major difference is that I have brought it. So here the rectal thermometer, the bulb will be very small and very much smaller in size and it is not pointed. Whereas in a oral clinical thermometer, you can see the mercury is very lengthier when compared to the rectal. Rectal thermometers are mostly used for all the pediatrics, especially less than 6 years of age. So is there any doubt till now? No. So this is how we do the during procedure. Are you aware of the aftercare? Yes? Hand washing. Yes. Before you go and touch the case sheet, immediately again as we have done in the initial step, take the hand rub, do the 7 steps of hand rub, palm to palm, palm to back and left arm over the left dorsum and right arm over the right dorsum, vice versa, interlacing, interlocking, thumb rotation, fingers and finally the wrist. This is it. And after that, yeah, we have to definitely record the procedure. In some of the hospitals, they have TPR chart or the early warning score chart. So you can use different color pens according to the temperature, pulse and respiration as per hospital policy according onto the patient's chart. Then, yeah, in case if there is any abnormality, don't forget to inform the doctor immediately. Like hyper or hyperthermia.
Replace the
Yeah, well said point. So all these have to be discarded into the respective bin. So cotton or waste goes to the biomedical waste management yellow bin, and if you have used the anything in the paper bag also, you are going to discard it. Then any other doubts you have? Yeah. So today you are thorough of how to, yeah.
Excuse me, ma'am, can you please tell me how to take the pulse?
Yeah, that's a good question. Can you come little closer? So to monitor the pulse, so pulse, if the patient is not having any vascular problems, you can go in for might be upper extremity or lower extremity. So the common sites of pulse is that you have temporal pulse on the temporal region, right and left. Then you have the facial pulse, just on the jawline. If you hold and feel, you can have the pulse both bilaterally, left and right. Always use the three fingers for rate, rhythm, volume and tension. Never use the thumb finger, whether right or left hand, because the thumb finger, your radial arch is crossing over the thumb finger. That is the reason why we are not using the thumb. Then carotid. So carotid to palpate from the trachea, you slide just 2 inches downwards on the groove, neck groove, you will have the carotid artery, right and left. But keep in mind that the right and the left carotid artery should not be palpated together, because the patient can go for coma. Then you have the apical pulse. So apical pulse is like fifth intercostal space. Just from the first clavicular bone is the first intercostal space. Slide down. So you will be able to palpate and slide down. Fifth intercostal space. Mid clavicular line. So this is your clavicle. So mid clavicular line, draw an imaginary line, and this portion is where the apex of the heart is the hold the full palm of the hand and place it. If it is a female patient, don't put it onto the breast tissue. You will have a wrong result. So you have to, one hand must be displayed away, and you can put it on the apical pulse can be palpated for 1 full minute, and you can find it. If the patient is feeling discomfort, you can use the stethoscope and directly place it onto the 5th intercostal space, mid clavicular line. Then comes your brachial pulse. So this area we call it as the area where the arm folds is the antecubital fossa. So in this fossa you have the brachial pulse. After you feel the brachial pulse both sides, you can go just have an like from the patient's thumb where the wrist meets is your patient's radial artery. You can use the 3 fingers and check the radial pulse. Similarly, we can go in for the lower extremities, such as starting from the knee. So just behind the knee you have the popliteal groove. In this popliteal space you can palpate for the popliteal artery. Then you have the dorsalis pedis pons, which is just above the foot, and then you have the posterior tibial just below the tibial bone. Over here you have to palpate this. Over here on the right side, just behind the tibial bone. So these are the major sites of 9 sites of assessing the pulse. Any doubt? Any other doubts you have? Yes? No. So in respiration, you have to check the 4 major criteria. So what is the rate? What is the rhythm of the respiration, inspiration, expiration, and the pause? Is there any noisy sound when you count the respiration? Because if there is abnormality, noisy sounds will be heard. And in some of the situations where the patient is need of or using other accessory muscles, you can just see and note it to the physician. This is how you have to assess the temperature, pulse and respiration. In case if you are going to assess orally, see that the patient is not taking anything hot or cold 15 to 30 minutes before the procedure. If they have consumed anything hot or cold beverage, please use the auxiliary technique. And if it is rectum, don't forget to use the lubricating jelly and then lubricate the thermometer, then insert 2 inches into the rectum. Any doubts? Shall we wind up? Yeah. So that's all for today. We have seen the total TPR assessment for a patient who are diagnosed with pyrexia of unknown origin. Thank you all.